Scope of practice. Introduction 3 Authority 5 Context 14 Competence 16 Glossary 18 Appendix A. Exemptions and exceptions for controlled acts 20 Appendix B. Requirements for delegating controlled acts 22 Appendix C. Nurses 1 often face decisions about whether they can perform specific activities. This practice standard outlines the legislated scope of nursing practice and other key requirements for nurses when deciding whether to perform an activity for safe client care. The term client care is used broadly to represent nursing practice across the system with individuals, families, communities, or populations and includes paid or volunteer roles. Scope of practice refers to a range of activities that nurses have the legislated authority to perform. This authority is defined in legislation, namely the Nursing Act, 1991 and the Regulated Health Professions Act, 1991, RHPA. Employer policies and practice-setting requirements, as well as the individual nurse's competence, also impact nurses' decisions and accountability related to scope of practice. This standard outlines the expectations for all nurses when determining if they have the authority to perform a specific activity, if it is appropriate for them to perform and if they are competent to perform the activity safely. The Nursing Act, 1991, defines the nursing scope of practice as the practice of nursing is the promotion of health and the assessment of, the provision of care for and the treatment of health conditions by supportive, preventive, therapeutic, palliative, and rehabilitative means to attain or maintain optimal function. Point 2. This standard expands on the accountabilities found in the Code of Conduct, the Code, the central practice standard for nurses. Nurses are expected to practice in compliance with relevant legislation, the Code, and all other CNO practice standards. Contravening legislation or failing to meet the standards of practice could be professional misconduct. 1. In this document, nurse refers to a registered nurse, RN, registered practical nurse, RPN, and nurse practitioner, NP. 2. See Section 3 of the Nursing Act, 1991. To meet the expectations of this standard, a nurse must consider each of the following key concepts. Authority. Nurses must know their legislated scope of practice, including controlled acts and authorizing mechanisms. Context. Nurses must determine if their practice environment or setting supports the performance of an activity and has the available resources to support safe client care. Competence. Nurses must ensure they have the individual knowledge, skill, and judgment to perform an activity. Each concept includes a set of nursing accountabilities, which are described in this practice standard. To ensure it is appropriate to perform an activity, nurses are expected to demonstrate these accountabilities. This practice standard integrates information from and replaces the decisions about procedures and authority practice standard and 2 guidelines, authorizing mechanisms, and the RN and RPN practice, the client, the nurse, and the environment. Bolded terms are defined in a glossary at the end of the document. Nurses must ensure they have the legal authority prior to performing any activity. This includes ensuring their practice complies with all relevant legislation, they have the appropriate authorizing mechanisms in place, and they have assessed the context of their practice and their own competence to ensure they can provide safe client care. Legislation. Nurses are accountable to practice in compliance with the regulations under the RHPA and the Nursing Act, 1991. The RHPA applies to all regulated health professions, while the Nursing Act, 1991 is specific to the nursing profession. These acts give nurses the legal authority to perform activities, including controlled acts. Other legislation also may be relevant to a nurse's practice. Nurses are accountable to comply with all legislation that applies to their practice or practice setting. Controlled acts. Controlled acts are defined in the RHPA 3 as acts which may be performed only by authorized regulated health professionals. The Nursing Act, 1991, authorizes nurses to perform specific controlled acts when providing health care services to an individual. Controlled acts are considered potentially harmful if performed by someone who does not have the required knowledge, skill, and judgment. Controlled acts authorized to RNs and RPNs registered nurses, RNs, and registered practical nurses, RPNs, are authorized to perform the following 5 controlled acts, if ordered by a physician, dentist, chiropodist, midwife, or nurse practitioner, NP, or if initiated in accordance with conditions set out in the regulation, and as authorized in their practice setting. 4. 2. Administering a substance by injection or inhalation. 3. Putting an instrument, hand, or finger. I. Beyond the external ear canal. 2. Beyond the point in the nasal passages where they normally narrow. 3. Beyond the larynx. 4. Beyond the opening of the urethra. V. Beyond the labia majora. 6. Beyond the anal verge. 7. Into an artificial opening into the body. 4. Treating, by means of psychotherapy technique, delivered through a therapeutic relationship, an individual's serious disorder of thought, cognition, mood, emotional regulation, perception, or memory that may seriously impair the individual's judgment, insight, behavior, communication or social functioning. 5. Dispensing a drug. Additionally, RNs and RPNs may dispense or administer by injection or inhalation certain medications. 5. If ordered by RNs with prescribing authority, if permitted by the setting and in compliance with all relevant legislation, the standards of practice of the profession and applicable employer policies. See Medication Practice Standard for dispensing requirements. 3. See subsection 27(2) of RHPA 1991. 4. Subject to the terms, conditions, and limitations imposed of the Certificate of Registration. 5. See subsections 18(3) and 23 of OREG 275/94. Controlled acts authorized to RNs with prescribing authority. Registered nurses who have completed CNO's council-approved education are authorized to perform the following additional controlled acts, in accordance with conditions set out in the regulation, and as authorized by their practice setting. 1. Prescribe a medication, or a drug from within a category of medications, set out in the regulation. 2. Communicate to a client or a client's representative a diagnosis made by the RN where the purpose of that communication is for prescribing the medication. Additionally, RNs with prescribing authority may dispense or administer by injection or inhalation a medication they are authorized to prescribe without an order from another authorized provider. For more information about RN prescribing, see the Registered Nurse, RN, Prescribing Practice Standard. Controlled acts authorized to nurse practitioners. Nurse practitioners have an extended scope of practice and are authorized to diagnose, order and interpret diagnostic tests, prescribe medications, and order other treatments for clients. Nurse practitioners are autonomous and are accountable for their own practice and to employer policies. Controlled acts are not the only legislated authority informing a NP's scope of practice and accountabilities. For more information related to NP's scope of practice and accountabilities, please review the Nurse Practitioner Practice Standard. Nurse practitioners are authorized to perform the following 8 controlled acts. 8,9. 1. Communicating to a client or client's representative a diagnosis made by the NP identifying as the cause of a client's symptoms, a disease, or disorder. 2. Performing a procedure below the dermis or a mucous membrane. Continued. 5. See subsection 5.1(1) of the Nursing Act, 1991. Subject to the terms, conditions, and limitations imposed on the Certificate of Registration. 8. See subsection 5.1(1) of the Nursing Act, 1991. Subject to the terms, conditions, and limitations imposed on the Certificate of Registration. 3. Putting an instrument, hand, or finger. I. Beyond the external ear canal. 2. Beyond the point in the nasal passages where they normally narrow. 3. Beyond the larynx. 4. Beyond the opening of the urethra. V. Beyond the labia majora. 6. Beyond the anal verge. 7. Into an artificial opening into the body. 4. Applying or ordering the application of a specified form of energy. 5. Setting or casting a fracture of a bone or dislocation of a joint. 6. Administering a substance by injection or inhalation, in accordance with a regulation or when it has been ordered by another healthcare professional or physician who is authorized to order the procedure. 7. Prescribing, dispensing, selling, and compounding a drug in accordance with a regulation. 8. Treating, by means of psychotherapy technique, delivered through a therapeutic relationship, An individual's serious disorder of thought, cognition, mood, emotional regulation, perception, or memory that may seriously impair the individual's judgment, insight, behavior, communication or social functioning. Exemptions and exceptions. The RHPA identifies some exemptions that permit nurses, under some conditions, to perform specific controlled acts that do not require an order or delegation for the performance of the controlled acts. Some settings or organizations may still require orders for these controlled acts for client safety. The RHPA 10 also provides some exceptions that allow persons who are not authorized as members of a regulated health profession, for example, unregulated care providers, to perform controlled acts in some situations, including emergency situations. For a list of exemptions and exceptions, see Appendix A, Exemptions and Exceptions for Controlled Acts. 10C Section 29 of the RHPA. Authorizing mechanisms. Orders. An order is an authorizing mechanism for a procedure, treatment, drug, or activity. Orders include direct orders and directives. An order is required when an activity is a controlled act authorized to nursing, with the exception of those controlled acts that a nurse may initiate on their own authority. See Appendix D. RN and RPN. Initiation of controlled acts. 9 Nurses can accept orders for controlled acts from the following authorized providers: physicians, nurse practitioners, dentists, chiropodists, midwives, and registered nurses with prescribing authority. 11. Involves the administration of a prescription medication that does not involve a controlled act, for example, oral or topical. 9 Nurses can accept an order to administer a prescription medication that does not involve a controlled act from a prescriber who has the authority through their health profession-specific legislation, is delegated and does not fall under a controlled act authorized to nursing, is a requirement by legislation that applies to a practice setting, such as the Public Hospitals Act. Orders may also be required as part of the client's plan of care or if specified in practice setting policies. 11C subsection 5(1) of the Nursing Act, 1991 and Section 20 of Regulation 275/94 under the Nursing Act, 1991. Direct orders. A direct order is client-specific regarding an activity. It may be written or verbal, oral. Verbal orders must only be used in emergency situations or when the prescriber is unable to document the order, such as in the operating room. Directives. A directive is an order for an activity or series of activities that may be implemented for a number of clients when specific conditions are met and specific circumstances exist. A directive is always written by a regulated health professional who has the legislated authority to order the activity and for which they have the ultimate responsibility. For more information, see the Directives Practice Guideline. Delegation. Delegation occurs when a regulated health professional, delegator, who is legally authorized and competent to perform a controlled act, temporarily grants their authority to perform that act to another individual, delegatee. Delegation by nurses. Nurses who are authorized to perform controlled acts can delegate them to certain individuals, including other regulated health professionals or unregulated care providers, for example, family members of clients. A nurse who delegates a controlled act is responsible for the decision to delegate and for ensuring the delegatee is competent to perform the controlled act. Delegation to nurses. Nurses can receive delegation for controlled acts they are not authorized to perform. Nurses who perform controlled acts delegated to them are responsible for the decision to carry out the controlled act and for the performance of the act. A nurse's responsibility may include delegating activities and accepting delegation of activities according to regulation, which specifies requirements that must be met. See Appendix B, Requirements for delegating controlled acts, and Appendix C, Requirements for accepting delegation of controlled acts. Delegation restrictions. The following are delegation restrictions for nurses. Nurses cannot delegate a controlled act that has been delegated to them. This is referred to as Subdelegation 12. Nurses in the temporary CLASS 13 and the emergency CLASS 14 are not permitted to delegate or accept delegation. Nurses in the special assignment CLASS 15 are not permitted to delegate to other healthcare professionals. Registered nurses and RPNs cannot delegate these controlled acts. 16. Treating. by means of psychotherapy technique, delivered through a therapeutic relationship, an individual's serious disorder of thought, cognition, mood, emotional regulation, perception, or memory that may seriously impair the individual's judgment, insight, behavior, communication, or social functioning. Dispensing a drug. Registered nurses with prescribing authority cannot delegate these controlled acts. 17. Prescribing a medication. Communicating to a client or a client's representative a diagnosis made by the RN where the purpose of that communication is for prescribing the medication. Nurse practitioners cannot delegate these controlled acts. 18. Prescribing, dispensing, selling, or compounding medication. Ordering the application of a form of energy. Setting a fracture or joint dislocation. Treating, by means of psychotherapy technique, delivered through a therapeutic relationship, an individual's serious disorder of thought, cognition, mood, emotional regulation, perception, or memory that may seriously impair the individual's judgment, insight, behavior, communication, or social functioning. 12 see subsection 37, 2, of OREG 275/94. 13 see subsection 5.1, 1, paragraphs 5 and 6 of OREG 275/94. 14 see subsection 7, 5, 6 and 7, 5, 7 of OREG 275/94. 15 see subsection 6, 5, 5 of OREG 275/94. 16 see subsections 35, 2, and 35, 3, of OREG 275/94. 17 see section 36, 2, 5, of OREG 275/94. 18 see section 36, 2, 5, of OREG 275/94. For example, nurses are not allowed to initiate controlled acts under the Public Hospitals Act, 1990. When an authorizing mechanism is not required. Initiation. Initiation 19 occurs when RNs or RPNs are permitted by regulation to independently assess and perform specific controlled acts without an order. Not all nurses will be able to initiate specific controlled acts, as this authority may not apply to certain practice settings because of legislation 20 or facility policies. As with all activities, nurses must ensure they have informed consent. See Appendix D, RN and RPN initiation of controlled acts. Nursing accountabilities, authority. Nurses are expected to demonstrate the following nursing accountabilities in relation to authority. Know and work in compliance with legislation, including 9. Performing controlled acts only in the context of a therapeutic nurse-client relationship. 9. Ensuring appropriate authority is in place in the form of direct orders or directives. 9. Following orders that are clear, complete, and appropriate. 9. Ensuring delegation, in addition to an order, is permitted and in place before performing a controlled act that is not authorized under the Nursing Act, 1991. 9. Ensuring that the initiation of activities complies with the regulatory and practice-specific legislation and employer policies. Document orders and activities performed or initiated as outlined in the Documentation Practice Standard. Obtain informed consent as outlined in the Consent Practice Guideline. 19 see sections 15 and 15.1 of OREG 275/94 of the Nursing Act, 1991. 20 For example, nurses are not allowed to initiate controlled acts under the Public Hospitals Act, 1990. A nurse who has the legal authority to perform an activity must also consider if it is appropriate to do so within the context of their practice setting. Context may include the broader environment in which nurses work, the healthcare setting, and the available resources to support the nurse and client. A quality practice setting is a workplace that supports nursing practice, fosters professional development, and promotes the delivery of quality care. This includes where and how care is provided to ensure all safety precautions are taken. Nurses must ensure their practice complies with all applicable legislation, including practice-specific legislation and employer policies. Nurses must recognize that employers can limit but cannot expand their legislated scope of practice. When employer policies conflict, Nurses' primary accountability is to meet the CNO standards of practice. Nurses must ensure compliance with practice standards and advocate for policies that support safe client care. Client safety is a shared responsibility and requires partnership. As partners, both employers and nurses share accountability for creating environments that support quality practice. Nursing is a profession focused on collaborative relationships that promote the best possible outcomes for clients. Nurses foster interprofessional relationships and routinely collaborate and communicate with the healthcare team to provide safe client care. Nursing accountabilities, context. Nurses are expected to demonstrate the following accountabilities in relation to context. Ensure practice-setting policies permit and support nurses to perform an activity. Assess and advocate for the necessary resources to support the performance of an activity and to manage outcomes. Support the development of a practice environment that enhances collaboration and leads to improved client outcomes. Consider any environmental risks that could impact the ability to safely perform an activity. Consult and advocate to the employer for clear employer policies and procedures. Collaborate and communicate with other healthcare team members for safe and effective client care and, as needed, escalate to an appropriate healthcare provider. Refrain from any activity that is not appropriate or safe for clients in the practice setting or under workplace policies. Perform activities in practice settings where health services are routinely performed. Comply with all safety requirements, for example, infection, prevention, and control, using best available evidence to inform practice. A nurse who has the legal authority and has assessed the context of their practice environment also must ensure they have the competence to safely perform an activity. Competence is the knowledge, skill, and judgment required to perform an activity safely within a nurse's role and practice setting. Nursing competence also includes leadership, decision-making, and critical thinking skills. Nurses are accountable to continually reflect on their practice and determine their learning needs to ensure they can provide safe client care. An individual nurse's competence can evolve over time. Being self-reflective and committed to lifelong learning is a critical part of providing safe client care. Nurses participate in quality assurance activities throughout their careers. This includes continually self-reflecting, identifying learning needs, and developing a learning plan to maintain competence. Nurses also must participate in CNO's Quality Assurance Program, which is a legislated requirement in the RHPA Point 21. The requirements needed to achieve the competence to safely perform a particular activity is specific to each nurse and includes education, training, and experience. Nurses are expected to communicate with their employer if they require additional learning or professional development to provide safe client care. 21. See the Health Professions Procedural Code and Schedule 2 of the Regulated Health Professions Act, 1991. Nursing accountabilities, competence. Nurses are expected to demonstrate the following nursing accountabilities in relation to competence. Demonstrate the knowledge, skill, and judgment to perform an activity safely and effectively, including 9. Understanding the client's overall condition and needs. 9. Understanding the purpose of the intervention. 9. Understanding the indications and contraindications. 9. Assessing the risks and benefits. 9. Demonstrating cognitive and technical competence to perform the activity. 9. Managing potential outcomes and modifying actions as appropriate. Determine if the client's condition warrants the performance of the activity. Perform an activity that is based on the best interests of the client and includes the client's wishes. Consult or transfer care to another care provider when necessary for safe client care. Refrain from performing any activity when not competent to perform and, as needed, escalate to an appropriate health care provider. Self-reflect, identify learning needs, and continuously seek out and integrate learning to improve their knowledge, skill, and judgment in relation to their practice. Participate in CNO's Quality Assurance Program. Activity, an intervention, procedure, or action taken to promote, manage, and support client care. Authority, when a nurse is legally entitled to perform an activity by the RHPA, the Nursing Act, 1991, and the regulations under those acts, is permitted by setting specific legislation and employer policies, and the required authorizing mechanisms are in place. Authorizing mechanism, a means by which the authority to perform an intervention is obtained or the decision is made to perform an activity. Client, an individual, family, group, community or population receiving nursing care, including but not limited to, patients or residents. Competence, the knowledge, skill, and judgment required to perform an activity safely and manage outcomes within a nurse's role and practice setting. Context, the broader environment in which nurses work, the healthcare setting and the available resources to support the nurse and client. Delegatee, the individual receiving delegation from a regulated health professional who has the authority and competence to perform an intervention under one of the controlled acts. Delegation, a formal process through which a regulated health professional, delegator, who has the authority and competence to perform a procedure under one of the controlled acts, delegates the performance of that procedure to another individual, delegatee. Delegator, an authorized regulated health professional who transfers to another individual the authority to perform an intervention under one of the controlled acts. Direct orders, client-specific orders that may be written or verbal. A healthcare professional, such as a physician, midwife, dentist, chiropodist, or NP, can give a direct order for a specific activity to be administered at a specific time. Directive, an order for an activity or series of activities that may be implemented for a number of clients, when specific conditions are met and specific circumstances exist. A directive is always written by an individual or a group, who are authorized regulated healthcare provider, who have the legislated authority to order the activity and for which they have ultimate responsibility. Initiate, a process where RNs or RPNs are permitted to independently assess and perform specific controlled acts without an order, in certain settings pursuant to the authority and conditions set out in the regulation. Professional misconduct, an act or omission that contravenes nurses' legislated obligations and/or the standards of practice and ethics of the profession. Professional misconduct is defined in Section 51(1) of the Health Professions Procedural Code, which is Schedule 2 to the Regulated Health Professionals Act, 1991, and further described in the Professional Misconduct Regulation, O.Reg. 799/93, under the Nursing Act, 1991. Appendix A, Exemptions and Exceptions for Controlled Acts. The RHPA provides several exemptions and exceptions that allow persons who are regulated health professionals, unregulated care providers and members of the public to perform controlled acts. These exemptions include ear piercing or body piercing for the purpose of accommodating a piece of jewelry. 22. Electrolysis. Tattooing for cosmetic purposes. Male circumcision as part of a religious tradition or ceremony. 23. Taking a blood sample by a person employed by a laboratory licensed under the Laboratory and Specimen Collection Center Licensing Act, 199,024. Diagnostic ultrasound. 25. Acupuncture. 26. Prescribing normal saline for venipuncture. 27. These exceptions. 28 include providing first aid or temporary assistance in an emergency. Under the supervision or direction of a member of the profession, a student is learning to become a member of that profession and the performance of the procedure is within the scope of the professional's practice. Treating a person by prayer or spiritual means in accordance with the religion of the person giving the treatment. Treating a member of a person's household and the procedure is within the Second 29 or THIRD 30 Controlled Act authorized to nursing. Assisting a person with their routine activities of living and the procedure is within the Second or Third Controlled Act authorized to nursing. Continued. 22 Regulated Health Professions Act OREG 107/96, S8, SO 2006, C27, S19, 1. 23 Section 9 of OREG 107/96. 24 Section 11 of OREG 107/96. 25 see Section 4.1 in OREG 107/96. 26 Section 8, 2, 3, 5-6 of OREG 107/96. 27 Section 13 of OREG 107/96. 28 see subsection 35 in the Regulated Health Professions Act, 1991. 29 Administering a substance by injection or inhalation. 30 Putting an instrument, hand, or finger as listed in subsection 4, 3 of the Nursing Act, 1991. Emergency situations. The RHPA allows members of the public and regulated healthcare providers to perform controlled acts without authorization when providing first aid or temporary assistance in an emergency. 31. CNO maintains, however, that in situations in which it is anticipated that emergencies will likely occur, such as in a hospital or long-term care facility, nurses should ensure a standardized process to enable nurses to attain and maintain competence in performing emergency procedures that are outside the controlled acts authorized to nursing. This process includes education and ongoing assessment of competence with the involvement of a health professional authorized and competent to perform the procedure. Documentation of the process. Written criteria to select appropriate clients and identify treatment parameters. Necessary authority and/or resources to manage client outcomes. 31C subsection 29, 1, in the Regulated Health Professions Act, 1991. Appendix B, requirements for delegating controlled acts. As outlined in the regulation under the Nursing Act, 1991, a nurse may delegate when all the following requirements 32 are met. Requirement 1. The nurse has the authority under the Nursing Act, 1991, to perform the controlled act. Requirement 2. The nurse has the knowledge, skill, and judgment to perform the controlled act safely and ethically. Requirement 3. The nurse has a nurse-client relationship with the client for whom the controlled act will be performed. Requirement 4. The nurse has considered whether the delegation of the controlled act is appropriate, bearing in mind the best interests and needs of the client. Requirement 5. After taking reasonable steps, the nurse is satisfied that sufficient safeguards and resources are available to the delegatee so that the controlled act may be performed safely and ethically. Requirement 6. The nurse has considered whether delegation of the controlled act should be subject to any conditions to ensure that it is performed safely and ethically and has made the delegation subject to conditions. Requirement 7. After taking reasonable steps, the nurse is satisfied that the delegatee is a person who is permitted to accept the delegation and is a member of CNO who has a nurse-client relationship with the client, a healthcare provider who has a professional relationship with the client, a person in the client's household, a person who routinely provides assistance or treatment for the client. Continued. 32C Sections 37, 39, and 42 of OREG 275/94 of the Nursing Act, 1991. Requirement 8. When the delegatee is a nurse or other regulated health professional, the nurse must be satisfied that the delegatee has the knowledge, skill, and judgment to perform the controlled acts safely and ethically. When the delegatee is not a regulated health professional, the nurse must be satisfied that the delegatee has the knowledge, skill, and judgment to perform the controlled acts safely and ethically and that the delegation is appropriate for the client. Requirement 9. If the nurse has delegated a controlled act but has reasonable grounds to believe that the delegatee no longer has the ability to perform the controlled act safely and ethically, the nurse must immediately cease to delegate the controlled act to that delegatee. Requirement 10. The delegating nurse shall ensure that a written record of the particulars of the delegation is available in the place where the controlled act is to be performed, before it is performed. Ensure that a written record of the particulars of the delegation, or a copy of the record, is placed in the client record at the time the delegation takes place or within a reasonable period of time afterwards. Record particulars of the delegation in the client record either at the time the delegation takes place or within a reasonable period of time afterwards. Any record of the particulars of a delegation must include the date of the delegation, the delegator's name, if the controlled act was delegated to the nurse, the delegatee's name, if the controlled act was delegated by the nurse, the conditions, if any, applicable to the delegation. Appendix C, requirements for accepting delegation of controlled acts. As outlined in the regulation under the Nursing Act, 1991, a nurse may accept delegation when all the following requirements 33 are met. Requirement 1. The nurse has the knowledge, skill, and judgment to perform the controlled act safely and ethically. The nurse has a nurse-client relationship with the client for whom the controlled act is to be performed. Requirement 3. The nurse has considered whether performing the controlled act is appropriate, bearing in mind the best interests and needs of the client. Requirement 4. After taking reasonable steps, the nurse is satisfied that there are sufficient safeguards and resources available to ensure that the controlled act can be performed safely and ethically. Requirement 5. The nurse has no reason to believe that the delegator is not permitted to delegate that controlled act. Requirement 6. If the delegation is subject to any conditions, the nurse has ensured that the conditions have been met. 33C Sections 41 and 42 of OREG 275/94 of the Nursing Act, 1991. Requirement 7. Nurses who perform a controlled act that was delegated to them must record the particulars of the delegation in the client record, unless a written record of the particulars of the delegation is available in the place where the controlled act is to be performed. A written record of the particulars of the delegation, or a copy of the record, is in the client record. The particulars of the delegation have already been recorded in the client record. Any record of the particulars of a delegation must include the date of the delegation, the delegator's name, if the controlled act was delegated to the nurse, the delegatee's name, if the controlled act was delegated by the nurse, the conditions, if any, applicable to the delegation. Appendix D, RN and RPN Initiation of Controlled Acts. As outlined in the regulation under the Nursing Act, 1991, RNs and RPNs may initiate 34 the following. 1. Care of a wound below the dermis or below a mucous membrane. Cleansing, soaking, irrigating, probing, debriding, packing, dressing. 2. Venipuncture. 2. Establish peripheral venous access and maintain patency when client requires medical attention and delaying venipuncture is likely to be harmful. 0.9% NaCl only. 3. For the purposes of assisting the client with health management activities that require putting an instrument beyond the point in the nasal passages where they normally narrow. Larynx. Opening of the urethra. 4. For the purpose of assessing the client or assisting the client with health management activities that require putting an instrument or finger beyond the anal verge. Artificial opening into the client's body. 5. For the purposes of assessing a client or assisting the client with health management activities that require putting an instrument, hand, or finger beyond the labia majora. 6. Treating, by means of psychotherapy technique, delivered through a therapeutic relationship, an individual's serious disorder of thought, cognition, mood, emotional regulation, perception, or memory that may seriously impair the individual's judgment, insight, behavior, communication or social functioning. Registered nurses who meet the conditions to initiate any of the above controlled acts may provide an order for an RN or an RPN to perform these specific controlled acts. 34C Sections 15 and 15.1 of OREG 275/94 of the Nursing Act, 1991. Scope of practice. College of Nurses of Ontario 101, Davenport Road, Toronto, Ontario M5R3P1. CNO at cnomail.org. 416-928-0900 toll free in Canada 1-800-387-5526.